Hey everyone, it's Dr. Rick, and today's tutorial slash unboxing slash minute clinic is brought to you by Herbal 411, but it's because of the work of one of my warriors, Teresa. Those of you who follow me on Herbal 411, you know that I have several different clinics. I wear a hat where I do integrative medicine consults. I also wear a hat where I guide people on medical cannabis, its uses, how to intertwine it with your medicines and your medical diseases, and I certify for medical cannabis. And the last clinic is a COVID clinic, and it has really ramped up, and I've been very busy with trying to help folks get over COVID. However, one of the keys, in addition to ivermectin and fluvoxamine and vitamin protocols and staying healthy, and knowing when to start getting back into exercise and healthy eating, is breathing. During the 2020 pandemic, when the surge in the United States was starting, there was an astute doctor out of Texas. I think he was suggesting that budesonide, which is a steroid, inhaled, presented to patients, gave better outcomes as far as the COVID pneumonias and the upper respiratory tract problems that are associated with COVID. COVID's entry level is mouth and nose, and then it goes into the lungs. Then everybody knows about the ACE2 receptors, but we're getting more and more details. And it seems to be COVID is really more of a vascular problem, a virus that causes vascular inflammation. Bottom line though, in addition to all the things that we do with repurposed medicines, vitamins, I think it's fair to consider a nebulizer. This is why. Inhalers were suggested by that doctor in Texas, and I think they worked great in the beginning, about 6 months ago when I started opening to COVID clinic patients. But the problem was that price of inhalers, especially steroid inhalers, Aerobid, Flovent, Pulmicort, very expensive. In fact, I tried to call a Pulmicort inhaler for a new COVID patient that's positive. Actually, the whole family's positive, if you ask me. And as I priced it out, all of them were $200 to $400 each inhaler. And just about 2 weeks ago, they're only like $39 with a Good RX coupon. And I have a link down below that I'll put on how to use Good RX if you don't have insurance or if your deductible is high. I think it's a great thing to have. Thank you, Good RX. But it saves people a lot of money. Now, the problem with jacking up and price gouging is not too many people can afford $200 to $400 for an inhaler. And ivermectin itself for 5 days, which really works well, is about $50. Fluvoxamine, because it is a repurposed antidepressant, is a little cheaper than that. But I think the three of these things, fluvoxamine, ivermectin, and nebulizers, or at least an inhaled treatment, would be a perfect match to get people through and accelerate their healing. Now, the problem is, if you can't afford that, do we just bag it? And I say no. I kind of just gave up on the last couple of patients because it was just too expensive. So I said, well, we'll just have to do without the steroid inhaler. A friend of hers has a nebulizer. And I just thought, steroid inhalers are one way to get steroid, an anti-inflammatory, into the lungs where people are really suffering. Calm down the inflammation and you'll get better faster. Now you can, or at least if you're an asthmatic, you probably know this, you can use the same medicine, not in an inhaler, but in a nebulizer. And this is a nebulizer. This is why I wanted to show you. This is my daughter's nebulizer. My daughter had asthma when she was a kid. That was back in the 90s. And now she's 27, and we still have this thing around. The machine itself, or the motor, all this is a pump. It's connected to a power source, and it forces air through this tubing. The tubing can be connected to, I already unboxed it, but this tubing here, let me show you if I can take it out. And if you do use a nebulizer, please don't use the same tubing as the 1990s. Get yourself some new tubing, because even though this stuff looks clean, there might be some mold lining this. So it wouldn't be good to try to rescue yourself with steroid and at the same time be inhaling mold. So that would be a trigger. Anyway, this is how you connect it to the tubing. And then this is where you put the medicine. So instead of you using a squirt or an inhaler where you take a deep breath and you hold the medicine in here and it gets into the lung tissue and then gets from the lung tissue into the bloodstream. You actually just do it in this, and I'm gonna fake a treatment plan. So these are the small ampules that contain medicine. Each of these ampules is 1 dose of a medicine. Now this happens to be albuterol, and that's how a carton of albuterol looks. Now, albuterol wasn't shown to help with regards to the inflammation from COVID. It's the budesonide or steroid. I just don't have steroid, but it looks kind of like this. So I can waste this because nobody in the house has asthma anymore. My daughter is actually going to have a baby, so I'm going to be a grandfather. This is the medicine. This is how you get it into the nebulizer. All you do is take this container off, and a lot of these are different in function, but you just pour this into the container. I'll just empty it since I can't use it anymore. Then you put the top back on, and now the medicine is in the container. The air comes from the pump, and then it comes out this way where you put your lips to it, and you just breathe through this. Now, all you have to do is with the pump, and remember, this is 20 something years old. You just turn it on. It's going to be a little loud. And it'll go through here if it works properly. And then you'll start to see steam sooner or later. All right. So I opened up the airflow up top. And you can, I don't know if you can see it, but the steam's coming through now. I can take a hit of this. It's albuterol, which is stimulant. But this works to reverse bronchospasm in asthmatics. I'll just show you what it's like. So if there's steroid in here, for 1 treatment twice a day, and that's a dosing, you just put your lips around the end and you do your breathing. Ideally, you breathe in through the mouthpiece and you breathe out through your nose. That's the way you're supposed to do it, but you can keep your lips at the end of this for the entire time. In through the mouth, out through the nose, until essentially there's no more liquid left here and no more steam coming through the end. When the liquid is gone, you'll know that you're finished with your steroid. In the case of which one, I would just do budesonide. And the budesonide carton that I gave to my patient, Teresa, it was about 30 ampules, and I sent it to Meyer because if you look on the GoodRx coupon site, Meyer's one of the cheapest. Meyer, Jewel Osco, and another one, Kroger, I think. I don't remember what Kroger is here in Illinois. But again, those pharmacies made deals with GoodRx, and they allowed for the discounted rate, thank God. So to get this nebulizer, this doesn't have a coupon on GoodRx. You'll have to buy this. I think Teresa said, I sent this to Meyer and it was like $40. It's not exactly like this. They're all a little different, but they essentially are the same basic components of a power cord, an air tube, and then a motor. And that's the basic premise. The old ones from the 90s are huge. Now you can just keep this in your pocketbook or in your luggage, and the pieces come together that you can put away. Now, here's one thing too. If you have children, this actually can disconnect and you can put a mask on them. The question is, if you have a child, will the child do better with COVID and budesonide? There's no data on that. The data is mostly anecdotal and adult use only, but I don't think it's going to hurt, especially if you have a child that's an asthmatic. You'll probably give them steroid inhaler anyway. But another way to do this, if you don't like the mouthpiece, this off, keep the tubing. I can't turn this upside down because there's fluid in there. And this is another way to apply it. So this is another way to get the medicine in. You pour it in this little cup, put the top on, get your adapter, and then you put one end over here and another end like this. As the air comes through the tubing and bubbles through the medicine, it turns it into vapor. Then you can inhale it or blow it out. I might have messed this up, but that's usually the other setup. And in addition to a mask, if you have a child that's moving around too much and won't cooperate. I don't take care of kids anymore, but you might have to ask your pediatrician to get this for you. When you do have this kind of setup and you have several people in the house that are sick, you really should be using different tubing. There are some CPAP distributors, especially the Center for Sleep Medicine. I love the way these guys, they send new tubing to my CPAP users every month. And really, you should, if you have the opportunity, you should change your tubing every month. It sounds like a lot of money, but with some CPAP companies, they'll do it as a free service to people who subscribe to them. If you don't have sleep apnea and don't use a CPAP machine, you just might have to buy this out of pocket. I'm not sure if this is paid for by insurance, but you can get these tubings. You just have to order them from the pharmacy. Especially those of you who are checking your pulse oximetry and you're getting low 90s, high 80s. Now, I did a video where I was on top of a 14,000 foot mountain and my pulse ox went down to 80 something and I was fine. But most of my COVID patients, when the pulse oximetry goes down to 80, that's kind of spooky. Now, the new Apple Watch does give you pulse ox. You can also buy a little pulse ox clip. There's variability to some pulse ox machines. If you're too tachycardic, meaning the heart rate's way too fast, it won't be as accurate, the oxygen reading. But for the most part, we can watch. In fact, what you can do is the sick person could put the pulse ox on. It just is infrared light that shines through the finger, and then it picks up on the other side red blood cells going through the finger, and then it extrapolates using a formula on the calculated oxygen per red blood cell. So that's how they came up with oxygenation. But again, if you aren't trusting your machine, put it on your finger. See if it matches your pulse. And number one, double check the pulse by checking your own pulse if you know how to do that. Doing that or this. I would never try to push on the neck. I think this is safer, but you have to learn how to check pulse. I think I have a video somewhere on how to do that. And then if your pulse is, say, 100, you look at the pulse ox, and if it is 100, that's accurate. If you still don't trust it, then you put on somebody else that's not sick, and you see if they are the same as you. If you both are in the 70s and you're standing up talking, there's something wrong with that. If you're low or high 80s or low 90s and you have COVID, I think that's fair. Yeah. Keep the pulse ox on. Take a couple of deep breaths. Fill up your entire total lung vital capacity, and usually the oxygen will come up a little bit. That's how beautiful the lungs are. A lot of us sit down like this. We're tired and don't take as big of a deep volume as we're supposed to. So if there is inflammation in most of the lung and you're only using half, you definitely will shorten the amount of oxygen coming in. So what you have to do is use your vital capacity properly. Sit up straight, take some deep breaths, use the diaphragm, all that stuff that I always tell you to do when you're supposed to be doing deep breathing, exercising, or doing that mindful breath at night. Same thing. You want to increase vital capacity. So a lot of deep breaths when the thing's on, and hopefully at least 3 times a day, you'll be able to get full oxygenation. If you can't breathe or it's difficult, steroids are usually twice a day. Either the inhaler, if you can afford it. Some of you with insurance might get it covered. So I'd always try first, if you're going to come up and join my clinic, we'll try to deploy your insurance, and I'll call a couple of pharmacies. If they don't cover the Pulmicort, which is my inhaler of choice, sometimes Flovent's pretty decent. Aerobid isn't made anymore. If it's not covered, then we'll go the good RX route, and then we'll have to get a nebulizer as well. But that's what this video is for. It is for those of you who can't afford it, and you can get this because of Good RX. Thank you, Good RX. And Meyer, thank you, Meyer, because they've always done great with even free antibiotics. So cool place. And they have good products at Meyer. I love shopping there. So if you have to go there, don't be shy. Bring the coupon, drive through, don't infect anybody else, and then get what you can. And then hopefully twice a day will get you feeling better quicker than just going home, staying under the sheets and isolating at home and drinking fluids and taking Tylenol. I think that's all the suggestions are as far as the CDC, which is fine, but I like to push the envelope to get my patients better faster, and all of them get better faster. I don't care what the data says on ivermectin, or I don't know why there's no data on Fluvox, because it isn't that controversial. With controversy, you have a splitting. Some people will love it, some people will hate it, and then there's arguments on both camps. Fluvox is out there too. I think it does work. I have one patient I put on Fluvox. She has better results on Fluvox than she did on ivermectin, but we still did ivermectin first, then Fluvox. In fact, if she's now 14 days out, doing great, healing slowly, but doing great. every time she postpones the Fluvox, the breathing becomes tougher. And certainly that could be placebo, but I don't think it is. I think this far out, I think it really does help. And it doesn't harm. That's the most important thing. Fluvox for 2 weeks, ivermectin for 5 days, prednisone steroid tablets, Z-Pak. In the case of Z-Pak, I think it's fair to consider it. If there is bacterial infection. If there's no bacterial infection, like a secondary bronchitis or a sinus infection, then I'd go with the ivermectin, the vitamins, and I'll put both protocols here in addition to the Fluvox. Omicron is on the rise. Even if you're vaccinated, you can still get this thing. So be very careful. I know the kids are going to be coming back this week from college, and college seems to be not only the melting pot, but the breeding ground for COVID. So those of you who have college kids coming back, if you have somebody that's immunocompromised at home, please be careful. It's uncomfortable, but I would still use masks. I would still keep a distance, even in the house, until at least 5 days has passed when the child or the young adult has returned home. If there's no symptoms for 5 days, then it's probably okay. But if there was an outbreak on the young person's floor or dorm or class, or they knew anybody with COVID, assume positive. I mean, young people usually do great. It's when the young people pass it to the older folks with several different comorbid conditions that the older boomers don't do well. And that's why you have to get rid of your comorbid conditions, even now. So please, get past this. We're going to get to the spring of 2022. This is your time to shine, but you do have to do a couple things to get past this. I know there's another pandemic coming or some other catastrophe coming, so let's all prepare. And let's elbow to elbow lock arms and get through this together as a community. If you have any comments on what you used, put them down below, or maybe places that you found they're cheap, even mail order. Otherwise, share this with other people. Don't forget to subscribe if this did help you. I have other videos I put out all the time. The next one's going to be about gut health, humic acid, fulvic acid, probiotics, prebiotics. So it'll be a good one. Stay safe, happy holidays, and I'll see you at the next video.